don't know what caused Max Berry's overdose, we do know this. Tennessee is one of the top-ranked states for opioid abuse and addiction. Physicians and policymakers agree something needs to be done. But as News Channel 5's John Newland tells us, we're a long way from winning the fight.
The drug epidemic in Tennessee continuing to get worse.
The nation's drug overdose deaths are decreasing, but the death toll here in Tennessee continues to rise for at least the 6th year in a row.
The opioid epidemic has stretched its deadly tentacles into almost every facet of our society.
We're a long way from winning the fight.
It often starts quietly. A prescription after surgery. Just a few pills to ease the pain. No one ever plans for their life to unravel, but for thousands across Tennessee, that's exactly what happens. This semester, our team, Ellie Housley, Ellie Walker, Scotty Brown, and myself, Emma Collard, set out to better understand the opioid crisis in Tennessee and how we, as individuals, can make a difference.
One of the things that we both saw as a challenge and also an opportunity was that none of us had a huge amount of exposure to this crisis.
Before we started this project, I did not know that much about the opioid crisis at all. I really probably should have taken the time to educate myself on the issue a little bit more.
Honestly, I didn't really know anything. I knew that opioids were a drug people were addicted to, but I didn't know the relationship to Tennessee. I didn't know how severe the crisis was.
I was kind of familiar with the issue, but not to the scale that after doing research, we really found that it was. Out of every 100,000 Americans with health insurance, 539 were diagnosed with an opioid use disorder in 2024. Out of every 100,000 insured Tennesseans, 1,447 were diagnosed with an opioid use disorder. This is nearly 3 times the national average, and it gives Tennessee the highest opioid use disorder rate in the nation.
I think all of us have been through the K-12 education system in some form or fashion. All of us have lived in Tennessee, and so we've at least been through and interacted with individuals from rural communities, but I think we didn't have quite as much exposure to opioids, so that was both a challenge but also an opportunity because we came in with kind of a clean slate, and I appreciated the opportunity to learn more from people who are much more seasoned in this field.
To broaden our understanding, we engaged with 3 key stakeholders throughout the semester. The first being Cade Jenkins, a sheriff's deputy working outside of Nashville. From Cade, we learned about the opioid crisis through the lens of law enforcement.
He's like, no cop wants to arrest someone who's just addicted to drugs and put them in prison for the next 8 months. Like they're like, that's not, no cop is like excited for that bust.
Cade emphasized that the real fight needs to be against the sources of these drugs, not the people trapped by addiction.
It's the whole idea of they're in this place of desperation and isolation where they're accepting the drug and taking it, and it's more about making it so they don't have access to it.
Although opioids are certainly distributed through illegal means, 86% of people with an opioid addiction were first exposed through a prescription. Tennessee has one of the highest opioid prescription rates in the country. 4,418,587 opioid prescriptions were filled in 2024. That is equivalent to 61% of our state's population. Once prescribed, many people struggle to come off the medication. To learn more about the opioid crisis from the lens of the healthcare system, we talked to Dr. Jennifer Torville. Dr. Torville is a nurse practitioner who graduated from Vanderbilt University. She is the executive director of the SMART Initiative, which stands for Substance Misuse and Addiction Resource for Tennessee.
Something Dr. Torville really emphasized was the fact that Tennessee is not a Medicaid expansion state. So for the people in Tennessee, there is that lack of health care, and it's often hard for residents of Tennessee to get the help they need when it comes to substance abuse.
When the Affordable Care Act gave states the option to expand Medicaid, Tennessee chose not to. This left tens of thousands of Tennesseans in a coverage gap, where they earned too much to qualify for TennCare, but too little to afford health insurance or qualify for subsidies. Additionally, Tennessee has the highest number of rural hospital closures per capita in the United States, with 16 closing since 2012. Medicaid expansion is one of the largest funding mechanisms for addiction treatment in the United States, and its absence in Tennessee is tangible. To learn more about how local nonprofit organizations are stepping up to meet this need, we spoke to Clarence Vaughn. Clarence serves as the Director of Access and Community Connections in the Haslam College of Business. He also serves on the Board of Directors for the Helen Ross McNabb Center.
Substance abuse and mental health disorders just really do go hand in hand. That's something that the McNabb Center specifically works with, is that they work with individuals who face those co-occurrent disorders, being a mental health issue as well as substance abuse issues.
The McNabb Center is a nonprofit behavioral health organization in East Tennessee. They serve over 50,000 patients annually, offering mental health care, substance use recovery services, social support, and victim services. They also offer multiple jail-to-work programs. From 2017 to 2019, the McNabb Center partnered with the Knox County District Attorney's Office and the Knoxville Police Department to run a pilot program called A Shot at Life. During the program, nonviolent drug offenders were injected with Vivitrol, an opioid antagonist, while incarcerated. Upon release, they received 12 months of outpatient care, followed by 6 months of aftercare through the McNabb Center. The pilot was very successful, with 73% of participants gaining employment during the program. Unfortunately, the program was not continued after donated medication expired and the grant money ran out.
Oftentimes, there are so many people who they don't need jail time, they need treatment.
With an issue as huge and complex as the opioid crisis, it can be difficult to see where individual action fits in. After interacting with these stakeholders, our team has identified 3 solution pillars, each one representing actions anyone can take to help fight this battle. The first is to donate.
One of the pillars of our solution is to donate. And I think one place that people who are especially concerned about this issue can actually make an impact is to choose carefully some selected local programs where experts out there are trying to fill that gap and actually make a difference in this problem on a local and state level.
Prevention is important. Rehabilitation is important. These jail programs are important. Youth programs, very important. But you may care more about one than you do the other because of personal reasons or life experiences. And so looking into these organizations and figuring out which ones most align with what is important to you and what you think would give you a good return on your investment, we believe is a really good, small, actionable step for you to take to combat this crisis.
Our second pillar is to vote.
I think voting is something really important when it comes to this issue of the opioid crisis, because so much truly does come from policymaking and policy change.
We're not going to sit here and tell you which way to vote, but just educating yourself on the different policies, because we're talking about life and death situations here.
Our last pillar is to volunteer.
Another way people can help out is that we just need more manpower. So individuals who feel particularly called to help with this issue can actually go and volunteer with their local organizations that are trying to fight the opioid crisis. And there are many ways you can do that.
They need more volunteers. They need more people with their hands and feet in the community, spreading the care and the love that the volunteers can give by being face-to-face.
Regardless of which pillars you choose to act on, we encourage you to not treat what you've learned today as just another statistic.
It's hard to make this just another political issue, and we shouldn't make it another political issue. That's why we need to really humanize this idea and see that this is something that is affecting so many people every day.
Earlier in the semester, I had one interesting interaction that really stuck with me. I was just getting my hair cut, and the woman cutting my hair asked me, how my day was going, and I was explaining that I was working on this project relating to opioids, and she said, "Oh, that sounds really interesting," and then proceeded to tell me about how a close family member of her had been on opioids and had a really tough time getting off after a difficult surgery and an injury. So many people in our daily lives have either been impacted themselves by this issue or people that they're very close with have.
The opioid crisis reaches into the lives of our families, friends, and neighbors. But although the challenge may be grand, through small but meaningful actions like donating, voting, and volunteering, we can help drive real change together. If you or a loved one are struggling with substance abuse, call or text the Tennessee Red Line at 1-800-899-9789.